suboccipital nerve innervates them, but the occipital artery perfuses them. That occipital artery that perfuses the suboccipital muscles is a branch of the ECA, or external carotid artery. And another unique feature about that occipital artery is that it travels with the greater occipital nerve. The greater occipital nerve is the DPR, or dorsal primary ramus, of our C2 spinal nerve, which is just after the suboccipital nerve, which is the DPR, or dorsal primary ramus, of our C1 spinal nerve. And that greater occipital artery is sensory-only innervation. It provides sensory-only innervation, and it runs to the back of the scalp. That's why the main dermatome to the back of the scalp, or the biggest dermatome to the back of the scalp, is C2, and the specific nerve that provides that is the greater occipital nerve. The suboccipital nerve is the DPR of C1, providing primarily motor innervation, while the greater occipital nerve is the DPR of C2, providing sensory-only innervation. And what's important about the greater occipital nerve is not only does it help contribute to that dermatomal innervation to the posterior aspect of the scalp, but unfortunately for us, it's associated with many headaches. And additionally, another anatomical feature that is unique about this greater occipital nerve is that the occipital artery runs with it. And that occipital artery perfuses the suboccipital muscles, but the suboccipital nerve innervates them. So the suboccipital nerve within the suboccipital triangle, formed by rectus capitis posterior major, obliquus capitis inferior, and obliquus capitis superior, innervates the suboccipital muscles, but the vertebral artery we see or find within this suboccipital triangle does not perfuse them, as the artery that perfuses them is the occipital artery, and that occipital artery runs with the greater occipital nerve towards the posterior aspect of the scalp.